So how are things going here today?
Things are going great. We had a nice busy day. I think we were able to help a lot of people. But one thing that we hear about a lot is issues of chronic pain, especially now because the opioid epidemic is kind of a big deal. And unfortunately, we're losing people. I read today that 80% of people that go to the street for heroin and illicit drugs actually start off having their opioid addiction from prescription drugs.
80%. Wow.
80%. So it's
Wow.
definitely a gateway drug. And it's been a big problem in this community, partially because providers were really at ease and reassured that we could give it to people and they wouldn't risk addiction. And unfortunately, that was more marketing than scientific fact. Yeah, really sad. And so now we know better how to use that tool, but it leaves people who have been using opioids or maybe unfortunately have some chronic pain condition with wondering what tools they can use to help their problem.
Is there a definition of chronic pain? When pain becomes chronic, or is it just sort of a loose sort of thing?
No, chronic in medicine means any condition that lasts for 6 months. I'm sorry, longer than 6 weeks.
Oh, okay.
6 weeks. So it's pretty easy if somebody has, let's say, a knee injury, that 6 weeks healing time is not uncommon, and even longer. And I think part of the problem too is that people don't clearly get diagnoses, and therefore they don't get treatment that's tailored to their diagnosis, and they don't get better as fast as they would otherwise. So
Now you mentioned you looking at it like a toolbox, which is interesting. So there's all kinds of
Right.
things in a toolbox. What's in
Right.
your chronic pain management toolbox?
Well, I started thinking about this by thinking any big problem in life needs multiple resources to solve. And what I was seeing in the clinic was that people were relying, and providers too, relying on only opioids as a tool. And to me, that was like trying to build a house with only a hammer. That you didn't, hammer's an important tool when you're building a house, but you don't have nails, you don't have wood, you don't have concrete, you don't have windows, you don't have all the other things that come together to form a house. And so I started thinking about, at any one time, I think somebody should have about 20 tools to help with their chronic pain problem.
Wow.
And then you can kind of take it from there. Now, the tools are refined specifically in reference to the diagnosis, and they're also refined specifically in reference to the patient. Like some tools somebody might find useful, but another person might disregard. But I have a list of them here. I think the first most important tool is what the diagnosis is. And I think it's totally fair to ask your healthcare provider, what is my diagnosis? And if the diagnosis is something like knee pain, then it would hopefully be refined from there using, different imaging techniques, maybe feedback from physical therapy. But once you have the diagnosis, actually the treatment falls pretty standardly.
Mm-hmm.
So, but some things that people use are pills and that are prescribed. Some are over the counter. Some are things that that's really in the patient's under the patient's control, but providers forget to tell them. So some things that I find useful are, of course, Tylenol and ibuprofen.
Sure.
Over the counter. The dosing is a little bit different in the medical world than it is in the over-the-counter world.
I find ibuprofen I get from a healthcare provider is about twice as strong as what you
Right.
get over the counter.
Yeah, and I usually give people parameters of what they can use. And the new news is Tylenol and ibuprofen can be taken together.
Okay, what was it before? Because in the past I've piggybacked,
Right.
back and forth, but you can
Right.
actually do them
You
together.
can actually take it together. This is one of those doctor secrets, is that we've been taking Tylenol and ibuprofen together for a long time, but we never bothered to tell patients they could do it. And the studies tell us that taking therapeutic doses of ibuprofen and therapeutic doses of Tylenol together are about equivalent pain control as one Vicodin.
Oh, wow.
Yeah.
Wow.
Yeah.
Okay, that's
And
pretty
then-
good.
yeah.
And it's good to do that, too, because there are different kinds of pain that
Right.
each treats.
That address, and they're also metabolized in different ways in the body. So Tylenol, we worry about a healthy liver. If somebody takes too much Tylenol, that can be a problem on the liver. If somebody takes too much ibuprofen, that can be a problem on the kidneys. But the guidelines that your provider give you, if you follow those, you should do okay. And kind of part of that too is taking 3 times as much as what your provider tells you is just like banging your head against the wall and being surprised that it still hurts. Okay, don't do that. The guidelines are really specific. We're in safety zones. It's called a therapeutic level. And one thing you should know about ibuprofen is it actually takes a couple of days of dosing to get to the therapeutic level with ibuprofen.
Oh,
So
wow.
you can't really expect to be better in 45 minutes.
I did not know that. Wow.
I know,
okay,
we don't tell
okay.
people
Yeah, I
that.
know.
So we really should.
I thought pills were magic and you just took them and you felt better,
No,
right?
that's Vicodin. and that works for 40, maybe 4 to 6 hours, and then somebody's got pain again. So we're looking at more long-term solutions.
Okay.
So other examples of prescription meds would probably be muscle relaxers, definitely can have a place. There are antidepressants that taken at low levels are really good at dealing with nerve pain.
I have a question before we move on. I'm sorry to interrupt with this, but we were talking about getting up to therapeutic doses of things like ibuprofen and Tylenol. What is a therapeutic dose of something like that compared to what you buy over the counter?
So the over-the-counter dosing for ibuprofen, they come in 200 milligrams. And I think the instructions say take 1 to 2 every 4 to 6 hours. We're really comfortable at people taking three times a day. And
Okay.
that's probably close to the maximum. 4 pills 3 times a day of the 200 milligrams is probably the maximum. Tylenol over-the-counter dosing for 325 milligrams is probably the same 1 to 2 pills every 4 to 6 hours. But most healthcare providers take the 500s and they'll take 1 to 2 of those 3 times a day, and that would be a maximum dose. A maximum dose of Tylenol for a healthy liver is 3 grams or 3,000 milligrams.
But a maximum dose, is that different than a therapeutic dose?
Yeah, exactly. A therapeutic dose is enough medicine to actually have the medicine work in an effective way, and not so much medicine that is going to cause damage to body parts.
Okay, and that's just dependent on what your diagnosis is, what kind of pain you're
Right.
trying to manage.
And maybe what other problems you might have.
Okay.
So,
Okay.
yeah. Or muscle relaxers are really helpful. Certain seizure drugs like gabapentin, really helpful for nerve pain. Certain antidepressants like Elavil, also really helpful for nerve pain. But these are often, people are often told to take these at bedtime, and I think one of the ways that they work is they put people to good quality sleep.
Okay.
And good quality sleep is actually medicine too, and
Yeah.
we kind of forget that because that's the time that the body can be, rest, heal, restorative phase, and oftentimes people don't really get that.
Yeah, no, that's just recently, because I'm kind of in I'm like in the kind of chronic pain that, somebody my age who does a lot gets in chronic pain.
Right.
And I've just a couple of weeks ago just was struck. I went to bed one night feeling just like I'd been run over by a truck. And you wake up the next morning and it's better. And I'm going, wow, that's magical.
Kind of amazing.
Just a good night's sleep. That's all
Yeah.
it was. Okay, so what else you have in the toolbox here? You've got
So other things, ice and heat. This is kind of a hot topic in medicine.
it says here maybe heat. Why that?
Maybe heat, because heat feels good in the moment to people, but the studies tell us that it prolongs the inflammatory response. And the inflammatory response is kind of good and bad. It's responsible for the pain, but it's also a little bit responsible for getting better. So heat feels good in the moment, so you have short-term benefit, but it's kind of bad because it prolongs the inflammatory response, and in chronic pain, that's the cause of the pain.
Exactly.
So long-term, kind of bad. Short-term, ice is like 3 minutes of why am I doing this, and then long-term, a lot of improvement. Ice helps with swelling. It decreases inflammation. It helps people become more mobile.
Now, what about the use of steroids? I see that a lot. I mean, a lot of
Right.
people talk about steroids, and I just have never interacted much with steroids. I don't know what you use those for.
So steroids can be used, this is where it goes back to having a really good understanding of what the diagnosis is. Steroids can be used generally, let's say in somebody who has a flare of gout. Prednisone is really useful in getting rid of that inflammatory response and helping the person get back to their normal functioning. And you can give oral steroids for something like that, and it works pretty quickly. But somebody perhaps who has chronic neck pain might need a shot of steroids directly into the spinal column. And of course, you would want that really clearly clearly understood where the problem was, and have a person doing it clearly understand how to do it, clearly understand the anatomy, and clearly be able to deliver the steroids to the problem area.
Okay.
Okay.
Okay. Well, that's something you'd go get a professional to do, right?
Yeah, totally. But that's all kind of dependent on a really good understanding what the diagnosis is for the pain.
Okay.
So then things patients can do, and a lot of these things works better for some people than for others, and I totally get it. But exercise is key. Keeping moving is key. And especially since in this community we're really lucky enough to have an excellent pool. I see a lot of people in there water walking or swimming, and I think part of the benefit of that is losing weight, which is helpful with chronic pain. I think part of the benefit is the water is kind of on the cool side, so it's a little bit like an ice pack. But I also think it gets the endorphins up, which is really, really helpful in controlling chronic pain.
What happens in your mind, in your brain, both chemically and I guess ideationally, is really, really important for pain management as well, right?
Yeah, endorphins are really important in protecting us from pain, but we got to put some effort into getting them to work for us. And so walking is really helpful. The pool is great. Hiking, anything that's got like moments of high intensity and then kind of backing off. You don't necessarily have to sweat, although the recommendation, if it's tolerable, is 150 sweat-filled minutes a week. That is at the threshold where people might start to lose weight, depending on what their diet is. And of course, if you've got problems, say with your knees or back pain, less weight means less pain. So that's a pretty common scenario.
That's good, but there are things that you have here on the list as well that I think are interesting. Journaling, prayer, support group.
Right. Yeah, working with the metaphysical and the spiritual, I think, is really helpful for people. Sometimes it's helpful just to understand that somebody else has a similar pain problem than you, and they kind of get how that affects your life. And just that understanding is helpful. A lot of people really do benefit from prayer, but it's not for everybody. And I think it's worth a try if somebody feels like that. I also think journaling can be helpful in certain chronic pain support groups. We'll talk about that. And kind of looking past getting rid of the pain into acceptance of pain can be very freeing for some people. It's not everybody's bag, though. Yeah. And I'm not saying, I'm not suggesting that people just get over it, but I'm saying they look to the spiritual to kind of help themselves get better.
Well, so much of health, so much of everything can be outlook, even if it's just what you're controlling is your own response to what happens.
Yeah, exactly. And I think we also have to understand that nobody should rely on any one of these tools to be the solution every day. That at any one time, somebody should have about 20 tools to kind of decide.
Well, what about like topicals? You mentioned like Tiger Balm, Bengay, things like that. Do those work? And is it just because it makes things warmer?
No, actually, I think they work on a deeper level. Tiger Balm is mentholated, and I think that actually independently from the heat has a probably addressing the inflammation in ways that we don't understand. Topical lidoderm, like lidoderm patches, are really helpful, and you can put them on places where you don't move. Like I don't think they'd be so great on a joint, but maybe in a neck. You know, like an upper back problem, they can kind of help those muscles finally relax. And they work well. They don't change the way somebody thinks and interacts with the world. You can still drive with them. And they're pretty flexible in that you can tailor the patch to where you need it. You can cut them up and kind of make a pattern that works for people. It's kind of the same idea a little bit as a TENS unit, although that goes to addressing nerves. That's an electrical stimulation of the nerves that overrides the pain.
Okay.
And that's something you could get probably in conjunction with a physical therapist, who are other great people to help with specific exercises. Again, going back to the correct diagnosis, a really clear understanding of what's going on, and physical therapists contribute a lot to that, and then also give certain exercises and stretches and different modalities that specifically address that particular type of pain.
It's true. I've known people in physical therapy. My mother went through some physical therapy and very specific things that you had to have sort of a specialist knowledge of anatomy and what to do in order to release this tension she had. Yeah.
And actually kind of tied to that are modalities like Tai Chi and yoga.
Yeah,
Because
what about non-traditional and what was
Right.
in the past called like Eastern medicine, what I think
Right.
doesn't apply so
Very,
much anymore?
very, very helpful. I think yoga can be really, really helpful for chronic pain. And actually, a lot of the exercises we hand out that we just call back exercises are actually yoga
Oh, the yoga
positions.
position.
So, we have some great classes here, and people really benefit. And again, I think you spark the endorphins is helpful, but I also think that you kind of help with the muscle spasms, and you kind of stimulate blood flow to the area, and blood flow has some healing properties.
Now, what about the more extreme non-traditional things like acupuncture?
Yeah, acupuncture and acupressure, not so common here. And massage, I guess you could add to that. Not so common here as Humboldt County, perhaps, but I understand there's some good practitioners in Brookings, so not very far away. Unfortunately, insurance is always a little reluctant to pay for that, but Eastern medicine has ways of understanding energy flows through the body that the kind of medicine that we mostly practice here doesn't really recognize, and I think that's unfortunate because you're going to have to really have multiple modalities to solve these big problems.
Wow, exactly.
And, yeah, I would highly, highly recommend it. Some patients tell me that's really the only thing that helps them.
There's one of our other underwriters is Connie McDonald at Soul Feed here in town,
Yeah.
and she practices a lot of different modalities and
Right.
does things. And she has said the
Right.
best way to approach things is with a balance between allopathic and traditional Western medicine too.
So going back to understanding exactly what the diagnosis is and maximizing resources. Yeah.
So everybody, it seems these days, has some sort of anecdotal evidence that CBD works. And I was just waiting for for us to do this today. Sitting here in the waiting room, reading a Sunset magazine, and there was a whole page about these two ladies in Eureka who are CBD specialists, and they were talking about in Sunset magazine. It blew me away.
Yeah.
Is there any science to support CBD and cannabinoids?
Not that I am aware of. I know that it's being studied, but I also think it's hard to study, and it's there's a lot of variables, and it's also that they got problems with legalities on the federal level.
Sure.
So I think a lot is anecdotal, but I think it's a hot topic right now in medicine, and I imagine that it does help some people legitimately, and some people may not benefit from it. So I think anecdotally it's not unreasonable to try.
Yeah. Make it
You
another.
gotta- Going back to maximizing your resources, sure.
And making sure your toolbox is full.
Yeah, and making sure that you're working with somebody who's legitimate and you're getting a product that's, on the up and up.
Yeah, exactly. Anything else?
No, but I think it's unfortunate that the emphasis on opioids happened in medicine. There are a lot of people here in the community whose perception of pain will be forever more intense because of their experience with opioids, especially difficult for people that have really tough chronic pain problems. But I think it all goes back to make sure that you've got a correct and a really specific understanding what the diagnosis is. And I think it's fair to ask your provider to help you fill your toolbox. I think if you go in there with an idea that, you're looking for the 20 tools that you can use at any one time instead of just focused on opioids, I think you'll get a better reception from the provider, and I think you'll get some more meaningful help.
Wonderful, Lynn. Thank you so very much.
Okay.
We'll see you next week.
Okay.